Power to the people we shine. Giving fans what they need. Caribbean spirit, let's succeed. Every show with a good deed. Together we plant the seed. Ride along, join the dance, let's sing the song. From island to island strong, with the host we belong. Energy high, heart so bright. Tune in, feel the light. Global love taking flight. Every ride a sheer delight. Making waves across the seas. Love and joy in the breeze. Ride along live if you please. Bringing hope with such ease. Ride along, join the dance, let's sing the song. From island to island strong, with the host we belong. Energy high, heart so bright. Tune in, feel the light. Global love taking flight. Every ride a sheer delight. Making waves across the seas. Love and joy in the breeze. Ride along live if you please. Bringing hope with such ease. Ride along, ride along.
Time to do better. Beacon's Be Better Group Health Plan now offers new and improved options that make health insurance affordable for small to medium businesses. Good medical cover gives you a competitive edge and takes care of the people that take care of your business. Get a better plan to build a better business. Call Beacon or log on to beacon.co.tt for more info today.
Pick yourself up with Ride Rent at ebike today and take advantage of the smartest and coolest way to get around. Rental starting for only $30 per hour and less than $100 EC per day. Zip through traffic, save money, and look awesome doing it. Check us out at the Esplanade Mall today. Visit us online at ridersebike.com or give us a call at 473-422-1011. Your wallet and the planet will thank you. Ride Rent at ebike.
Ride along live, worldwide. Feel the beat, feel the vibe.
Yeah.
Amazing host leading the ride.
Welcome to Ride Along Live for today. It is Monday on the ride. Thank you. Ride Along Live. Jennifer Lawrence, how you doing? Happy to be in the air chair. Guys, as I told you last week, I'm here in Toronto, Canada for the next couple of days. So we're in this makeshift studio for a bit. So, you know, it goes sometimes, right? When we're not at our home studio, oftentimes we get some problems with internet connectivity, chalala. But hopefully we don't have none of that today, okay? Hopefully we don't have no problems today with internet. But if it happens, you know, we're always going to try to reconnect, okay? All right, nice. Yeah, guys, so here today we have a very interesting conversation, an important conversation, guys. I think a long overdue conversation with the Minister of Health, the Honorable Philip Telesford. We're going to talk about a range of things. And this is not just me having a conversation with the minister. This is an invitation for everyone, you included, to join in on that conversation. All right, so we can open up the phone lines. I know you have a lot of questions about health, a lot of questions about healthcare. There have been a lot of things, you know, all over the place. Some say it's myth, some say it's true. Some people putting it out as if it's true. But today we have an opportunity to confront the questions that have been swirling all around. We've been hearing instances of babies that died in the general hospital. What the hell is going on with healthcare? We are going to address it here today. No holds bar, full steam ahead. The minister is here and he's here to answer all of the questions that we have for him on this platform tonight. So everybody share the program, because I said it's a very interesting, important, more than anything else, it's an important conversation to have, because your health is your wealth, right? Your health is your wealth. And with it, you can have $1 million in the bank, but if you're sick, if you can't get well, it really doesn't matter how much money you have in your bank. So it's very important that we address the issue of health. Very, very important. So share it to everybody, guys. Share this program to everybody. And furthermore, at followers. Click the at followers, type at followers, and so that everyone in your friend group, everyone that's following you, they would be able to be a part of this conversation here tonight. Thank you so much. Nikisha, thank you so much. Suzanne, thank you so much. I appreciate you. Paris, thank you. I'll also like to thank and big up, of course, I salute my producer, Lois JJ, for always holding down the fort. Yes. And we know. We've been hearing this stuff about healthcare, healthcare in the United States, healthcare in the Caribbean. People that want to move back and they're scared of, what would be their fate if they get sick. All of these things are legitimate questions that need to be, that has been asked and need to be answered. And I think this should be a hot seat because, it is definitely a very topical issue. Tag everybody. Just tag. I want everybody to be in on this conversation right now as we bring in the Honorable Minister Philip Telesford. Once we good, yes, Jennifer, everybody tag. Lydia, everybody tag. Because I don't want nobody to say they missed this program, Some people are already miniaturizing the platform, saying we're just a podcast and trying to insinuate that we don't reach the people that need to get the information. When this is totally not true. So we want to make sure that everyone get this information far and wide. All right, far and wide. Make sure everyone get this information. It is very, 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 very important that you do that. All right, so guys. Without further ado, I don't want to do any much more talking. Let us introduce to you on the platform, no stranger to Ridealong Live. He is the current Minister of Health in the hot seat today, Minister Philip Telesford. Minister, welcome to the Ride. How are you doing, sir?
Good afternoon, Junior. Well, good evening, Junior.
Yeah, man. Well, let me tell you, you're in the hot seat today because...
Well, the way you put it when you called me, you said I am being summoned to court. There's a people's court, so here I am at your mercy.
Yes. Now there is a lot of questions. There's a lot of questions, and I appreciate you taking the time to come chat with us, Minister, because there's a lot of burning questions on our riders, the minds of our riders. Today we're going to address some things to do with claims of privatization in the healthcare. We're going to also talk about response to Mr. Damon Cloudon, the young man that fell off that roof in Karu. Talk about his case and what efforts the healthcare, what was done. We're going to also talk about addressing the death of babies at the General Hospital. There was a report, even on this platform here, we had stories that were shared where at least two individuals claimed that their child, their baby, young child, died in the General Hospital, and the further plans for the Ministry of Health. So those are some of the things that we really want to touch on. And of course, we open up the platform to our viewers so they could ask any questions that's on their mind. Minister, so how first, before we go on with putting you in the hot seat, how was your day? How have you been? How is your day going so far?
Well, I'm always at the mercy of Prime Minister on Mondays. So we just finished cabinet.
Okay.
Well, we had to cut cabinet short. So you know how it goes from morning to evening. So usually on Mondays, very tiring. But I would say every day of the week, I am extremely busy. So that's just the way it is. That's life.
Yeah. And you are the helm of that ministry that there have been so much things that have been coming up. And as I said earlier, your health is your wealth. So let's first start with the question of, and addressing the death of, death of babies, young kids at the General Hospital. There have been some reports of infants' death at the General Hospital. What is the ministry official statement on the unfortunate incident?
Well, first and foremost, the passing of any individual really saddens our heart, regardless of age, sex, or anything of the sort. And so we are always moved with compassion. In these circumstances, I'll be very honest, it's very difficult for me to really deal with this subject. But what I want to assure you that on every occasion, I engage the pediatric unit at the Ministry of Health. Also, the intensive care unit, as well as the director for hospital services. Because of, anytime somebody passes and there is a stirring, as minister, you want to get to the bottom of this. You
Yes,
want to
absolutely.
understand what is happening and whether or not there are cases of negligence.
Yes.
So I must say to you that I have even video footage to verify some of the things that I can say to you. But
Okay.
I want to say to you, there's some things I will not say and should
Okay.
not say, because you will not see a doctor or a nurse coming to the media and ever trying to defend themselves or speaking relative to any medical condition, any parent, any patient, sorry, dead or alive.
Right.
So one has to be always careful, because sickness and death are very sensitive issues. So I just want to clear this. Now, when I was growing up, my mother always used to say, and she's still alive, God bless her, that be careful. I don't want police coming in front of me though. And I don't want this and I don't want that. So she always had that protective eye and protective hand on us. We are witnessing a period in our country where parents need to be more vigilant. And that includes myself. Now, parents need to take the children to the doctor well in advance and in good time. Every Grenadian, but in particular our children, should get the annual checkups and the regular checkups, especially those young infants. Follow the doctor's orders. Take your medication on time. Give the children the medication. And not because you are of a certain belief means that you can do as you like. These children are innocent. They don't understand what we believe to begin with. So think life when we think in these children. I'm saying these as some my opening statements because there are a lot of things that happen and we cannot speak about it.
Right.
But as adults, we must understand that the children are not our playmates. We have a duty of care. We have a duty to be vigilant when it comes to these young children. And I am speaking to you here because I am a father of 4. My youngest son is 6 years old. And the things that these children will do will blow our minds. And sometimes they get sick. Might be in the middle of the night and you're telling yourself you don't want to go to the doctor. And the next morning you want to rush out to your meeting and you tell yourself, well, they're good, they could make it. And it goes on and on and on. And we fail to pay attention to the small things.
Right.
And over a period of time, these small situations get complicated. And then we rush the children to the doctor. And we expect our doctors to work miracles. Let us understand, when a child enters intensive care, it is a matter of life and death. So we have to understand these things. We cannot wait until, as the old people say, water more than flour, to take our children to the doctor, simply because we want to go to a fete, or we watching the clock, or we have to go and make $1, or we too lazy to get out of bed, or we just find we can't take more pressure. We have to understand that these young ones are the future of our country, and we must respond to them accordingly.
Right. That probably spoke to a particular story that we even had here on the ride. But there were other instances that spoke to newborn babies, not even a day out of the hospital. We heard instances, report and allegations about even twins, young kids that just born, that didn't even make it out of the hospital. How do you address that? And how is the hospital services dealing with stuff like that? When you could have 2 and 3, and some instances, reports of infant fatalities at the hospital.
Junior, if you want a healthy child begins with the relationship that you have even before that woman gets pregnant. That relationship with man and woman, that's where the healthy baby starts. So when that woman is pregnant, if you want a healthy child with a balanced mind, strong character, intelligent, and all of these things, as mother, you must be properly loved and cared for by your partner. I'm sending this signal out to men. That's one. Secondly, mother needs to exercise, take your medication on time, follow the doctor's orders if you want a healthy outcome. Also, we are from the black race, which means we are susceptible to certain diseases and certain problems. And therefore, we must follow the doctor's instructions. We do not know more than the doctors. So we have to follow how they guide us. And that is going to help immensely. So some of these young babies that die, and I'm not pointing any accusing finger, because it does not make sense.
Right.
But we must appreciate that these children will have, for them to end in this condition, it means that there was a problem. It was not a natural, healthy birth. And we must appreciate these things. There is no doctor who set out to hurt any child at the Grenada General Hospital or any medical facility in Grenada. We do not have these kind of people operating with us. It does not exist. Let us appreciate this. Listen, one morning I flew over, and I have to call it that because I had other engagements. By 8:15, I packed up my bag, journeyed over to the hospital to meet with the pediatric unit. The doctor's brother, literally in tears, not figuratively, literally. Minister, I have babies too. I have a child too. I live with my mother and my father. I have a family. To hear people saying that about me, I don't even feel like coming to work, because I know that I go over and beyond, leaving my baby at home, neglecting my own family to be at the service of the nation. Brother, we need to be careful, because we're already short on doctors. And if you want to encourage young people to take up medicine as a professional, to be nurses and doctors, and I tell you the truth, a lot of us who are making all these noises, they'll never touch some of these patients. Never even want to come close to some of these patients. And let me tell you a problem that we've been experiencing at the hospital. People are bringing people to the hospital, and time to go home, they're leaving them right there and asking the government of Grenada to find a place for them to live. That is the new problem that we have in. But it is existing in Grenada. Unless the government passes a law that tells you cannot do those things, that's the problem that we face with.
Minister, in any one of these reports, has negligence played a role in any of this? And I agree with you. Let me just back up on something that you said earlier. in terms of doctors and nurses leaving their homes. I had an incident that happened to a friend of mine at a hospital facility in Karu. And I give my gratitude to the way how the doctors, they basically, they work overtime to ensure that everything was well. So I know that the doctors and nurses, they leave home not to come and say, well, you know what, I'm going to see which person I could kill today, well, not, I don't want to put it in that term, but they come to work to help. And I know that for a fact. There are some brilliant nurses and doctors. But in any one of these cases reported, was did negligent play a role in any of these reports?
They are good, decent doctors and nurses. But the truth is, there are some who do not do the work to the best of their ability at times. And these people, we must deal with them. And we have to have these conversations with our unions, because at the end of the day, if we build a system that says if I wake up and I ain't feel too good, and my boyfriend give me too much pressure, or I don't like the government, I could do otherwise. I tell you the truth, and I'm going to say this right here. Last week, a young lady, after waiting for hours at a hospital, was turned away. I got this call, and I said, look, I am not dealing with hearsay. If this is true, get the individual to call me and let me put the question
Right.
to the person. After spending hours at a hospital, a medical doctor would make reference and say to this young woman, that is the government you voted for. Now, let me tell you something. When it comes to taking advantage of people, when it comes to unfairness and inequity, I have a real problem with that. These comments should never be heard around medical quarters, because medicine is about life and death, brother. So we don't accept that. So I'm saying to you, I'm not saying that the doctor intend to do ill or will do ill, because we have never seen that kind of behavior. But I'm saying that there's some attitudes that lend itself to that kind of behavior. And if that is the case, we must deal with these issues. But by and large, we can be proud of what we have as a people that work within the system. We are proud. I am proud as a Grenadian, because actually, the story that isn't told is the miracles that are performed at the hospital.
Yes.
The stories that isn't told are those that where the doctors work well beyond their call of duty,
Yes.
past ordinary times, making huge sacrifices, staying without meals to ensure that the patient is well. Those that aren't told are those where surgeries are being conducted. When you open up the patient, things are not going right. What they saw is more than what they expected. And doctors will work many, many hours beyond the call of duty to ensure that that patient comes out alive. Those are the stories that aren't told. But there are a few that are being told. And those that are being told are only the negative stories. And that cannot be fair. But I say to you that those that come to the surface that are not where people make these political statements, and it's not about politics, we have to understand this, but those who are negligent in their responsibilities, they have to be dealt with. Because if we build a system in which people are not treated as human beings, you and I are going to get sick one day, and the same place we're going to end up, and there's this same or worse treatment we will have to endure. So we're not going to accept anything worse than that. So we are addressing these problems. It's not that we are turning a blind eyes, and we cannot turn blind eyes on these things. We must address it. But there is a due process that has to be followed.
Yeah. So, what is the current morale of nurses and doctors at the hospital? Because hearing all of these things, I'm assuming that coming in and hearing press or media or talking heads degrading nurses and doctors to the point where they're accusing them of all of these things. How is that affecting their day-to-day morale?
Well, it cannot have a positive impact. I call upon us as Grenadians to think first before we say. Think before we say. The truth is, our health condition, the deplorable nature of health in Grenada, did not arrive this way in 2022 because one party win the election over another. Let us be fair about it. As a matter of fact, the NDC won election by and large because of the deplorable state of health. Health is something that you cannot fix overnight. So we have to develop a policy position and a strategic framework that will deliver quality healthcare. Look, when I took off in this ministry here, it took me months going through the various pieces of legislation, understanding all the organizations that operate around health, and how does health interact with all the other private entities. So it is not something that you can just jump in and jump out.
Right.
And it's not a ministry that you can just start to work today and just start to fix things. Because if you think you're fixing, you might well be undoing
Right.
rather than fixing.
Right.
So I had to take a very calculated approach towards treating with how we function and how we fix the system. And I believe that I am now in a position where I can make solid decisions towards repairing the system.
Right. I know that they talk about having a very imperfect healthcare system is something that many administration spoke about. The healthcare system is deplorable. I've heard that before. But what's the administration plan to do, and what have you been doing to make it better from the time you were elected from 2.5 years ago to a day like today? What have been the changes that put in place to make it better?
Right. So I will give you a few things before I actually delve into it. Because when I came into the ministry, I actually thought that I could have just rushed in and do things. But health is so different to the other ministries. Now, you have limited doctors, limited nurses, limited equipment, limited facilities. All of this is limited. Now, if we have to buy a piece of equipment, you have to go through a whole process that is outside the Ministry of Health, including the engineering, including the procurement and the actual payment for the equipment. All of this happens outside the Ministry of Health. If you have to hire a doctor, you can't just hire a doctor. We must go through either Public Service Commission or DPA to get a doctor hired. And after that person's hired, even the payment of that doctor or nurse or orderly or support staff, engineer or whoever, takes a whole period. And if you're not on that case, it can easily slip you. If we have to treat with any repair, any expansion, any fit, you have to go through the Ministry of Infrastructure. Like everything, the way it is set in Ministry of Health, you can make all the decisions
Right.
you want. But when it comes to actually executing, there is a ministry for executing every other thing. The only thing you can execute is a decision in the ministry.
Yeah, but if there is so much bureaucracy in the Ministry of Health, is that the reason why previous administration, as the current administration said, did almost nothing in health? Are you now seeing why a lot was not done because there's just too much bureaucracy inside of the ministry?
Exactly. Exactly. That is exactly the problem. And so this brings me to the whole issue why you dragged me into your courtroom,
Yes, sir.
where it is stated that something about privatization or some nonsense like this, which is
Right. I
totally
want to get into privatization. No, a very, very important topic. I want to nail down on privatization. But I want to, before we get into privatization, I want to talk about this. The fact that a lot has not been done. There's a lot of bureaucracy. Cleaning up the bureaucracy. And what is the administration doing or have done within the 2.5 years that you've been there to fix some of the bureaucracy and the problem that exists in the Ministry of Health?
Junior, when you go, any issue you have at the Ministry of Health is an emergency for us in the ministry. You'll get a call midnight as minister.
Right.
Check your phone first thing in the morning. There's a message from a doctor, from a patient, from somebody. Everything in this ministry is an emergency, and we respond accordingly.
Right.
We respond. We don't sleep on things. We work. Trust me, there is no slow time. There is no off days within this ministry. Look, let me give you this. 2 weeks ago, I answered to a three-way call. The number I did not know. A doctor on the other end of the phone, and a mother on one end, and I on the other. I answered a three-way call. The doctor in tears, Minister, I don't know what to do again. I'm calling you. I cannot take anymore. I am literally trembling. I am overworked. I can't go anymore. I am burnt out. And they're asking us to give more, and I cannot give anymore. Because we have limited resources. So we have taken the initiative to start scouting for talent.
Yes.
I am in the process of signing a few MOUs. We are in the working stage of signing those MOUs to get bodies into Grenada. I picked up the phone and called my colleague minister in Guyana. And in a short period of time, in a couple of weeks, we're going to have an anesthesiologist joining here on a year contract because they couldn't even do surgeries at the hospital because the person we had there defected. I picked up the phone. I made a phone call, and somebody will join us here on a contract for 1 year. These are the realities. We have people, I've secured some scholarships for people to go off to study anesthesis and to be anesthetists and anesthesiologists. We are going to have those next year. But those are not immediate fix. It will happen over a period of time because these people
Yes.
have to be trained.
Yes.
We're in the process of getting some additional equipment and support from our friendly governments every single day, brother. That is my call. That's what I've been working on. I don't like the noises and the running about. As a matter of fact, if I am treating with these friendly governments, I can't take your call when you call. This is what I am engaged in. We have new frontiers as far as scholarships are concerned for young professionals to go and educate themselves in various areas. We have a number of people overseas studying different specialty areas in nursing and and specializing in doctors and so on. We are training our people. It's a process. But
Yeah.
in the meantime, I have two Ukrainians coming week 2 to join us. A theater nurse and an anesthesiologist. We have
Yeah.
these people coming in. And these are the things we have to do. So we have to fill the HR needs and we have to fill the equipment needs. We just came out from a 2-week period where we've been getting down at our budget, trying to examine what needs to be fixed, what decisions we need to take so that in 2025 we can have a better year. So it is not easy. Listen, healthcare, it takes between 5 to 7 years to have a doctor trained.
Right.
So it's a whole process, but we have to open new frontiers. We have to we have a number of teams that have come down to to partner with us, a number of medical brigades, medical, we had a lot of surgeries done just a couple of months ago. We had the dental team came down, the eye specialist team. We have another one coming up to the end of this month. We're going to be doing some surgeries. We just completed one at the end of September. A number of people coming down to do surgeries and different things.
But
I mean,
what about the relationship? I know that we have a good relationship. Continue to be blessed with a good relationship from Cuba, which they provided us with some good doctors over the years. What happened to that relationship? Is that an open invitation still? Is that relationship still exist? Does that relationship still exist, I should say?
yeah, of course. I mean, but of course, Cuba can't solve all of our problems. Just today, I signed off that renewed MOU with the Ministry of Health, Cuba. But one government can't solve all of our problems. But we have been working with all of our friendly partners to make this thing work. It's not, but listen, it's a number of different specialized areas,
Right.
right? And sometimes you have to even try to get people to go overseas or get a team to come in to do the surgeries that we need to get done and so on. So, I mean, brother, this job is very intense,
Right. Yeah.
very intense
But
because you're
to,
talking
to the
about
to the
people's lives.
mother, the father, the brother, the sister, whoever loved one that's laying on a bed in the hospital right now and needs care, the last thing they want to hear anyone say is that this job is intense and we're working on something over a long
You
period.
wouldn't hear that, no.
They don't want to hear that. They want to know one, what is being done right now to get me out of this hospital. I'm in pain. I don't even want to hear nothing. What can I do? How can you help me? How could you give me what I need at this moment, instant gratification, so that I could feel better? That's all they want to hear. So what is the ministry doing now? What could be done? Is there any instant gratification in the whole ministry of health? Is there anything that we could do now?
Right. So presently, again, we have taken a decision and we've sent out a call, and we have some volunteers coming in. Retired nurses, volunteer nurses, retired doctors, volunteer doctors. They can come in. The call is out, loud and clear, that we are. Prior to now, that was not possible. You
Right.
can come in to do short-term service if you want to do 2 days a week with us, right? And why are we doing these things? We are doing these things so that we can free up the other doctors to do the more intense jobs. So, for example, the emergency unit, right? We want to ensure that that unit is properly staffed at all times. There is always a nurse. There's always orderlies available to work on the on the ambulances, and there are always people to receive you when you're coming to the emergency unit. So all of these things have been approaching head on. Again, that the call has been out for the retired nurses to come back in and to support, and so the returning nationals. Some of them have worked for years overseas and they're available. We say, come in, and we have started that process, brother. So from every single angle you can think about, we have been making the advancement to ensure that we plug those holes and we solve those problems every single turn you think about.
Now, there have been claims and that's the topic that you wanted to get into, because it's so much things that we've been hearing. The claims of the hospital privatization. Is there any truth to that?
Well, Junior, I tell you the truth. I sometimes I find it so funny that, and I ask myself where these things come from. Do we have a factory that manufactures these falsehoods? Where these things come from? How does someone come up with these kind of things? Where it came from? But in any event, no, we have. They said that I read it that there was some meeting. Who conducted this meeting? Where did it come from? That is absolutely false. There is no selling of any of our government owned health facilities. No hospital, no healthcare center, no nothing. That ain't happening. That's not our policy. That's not our aim. That's not our desire. We're not selling any of our health facilities. Point blank.
Okay, I think you need to reiterate on that, because it and it's funny you said, where this thing come from? Your song, like, where does this come from?
I don't know. This is so funny.
So you're saying that the claim, the talk about privatization at the general hospitals is completely false and made up?
Yes, it is. It is made up. There is no privatization, no intention to privatize any one of those health facilities. No hospital, no nothing. That is false.
Right, right. Do you believe, right, that that any private agency or firm or individual, or not even private, but say public, say like Kings County or the regional or international hospitals, could play a role in bettering the healthcare system in Grenada? Do you think, in not privatized, but closer working relationship with those facilities?
All right. So let me explain this. And the answer is yes. We have signed an agreement with Mount Sinai International
Okay.
to assist us in firstly analyzing and identifying where our gaps in services are. Why do we go with them? Because we need the best for our country.
Right.
And listen, I don't want us to get into an argument with this. This is a very simple professional engagement, right? So we are asking them to come and lend us the expertise to evaluate where we are, because they have done this for, I believe, it's more than 100 years, if my memory serves me well, in terms of the company profile.
Right.
They have done this. They are renowned. They are one of the best globally. All we want from them is to assist us in identifying these gaps and hold our hands to work side by side with our professionals, train and develop our people to be responsive to emergencies, to adopt the very best practices
Yeah.
in terms of medical care, develop a model that works for the Grenadian society. And brother, this is about a professional engagement. It has nothing to do with any privatization. Just in case anybody thinking that, let me be abundantly clear. It has nothing to do with that. We are not going down that road. It is a strategic relationship. And the truth is, Grenada needs that if we have to win. Grenada needs that if we have to rise from here. Grenada needs that if we have to change the culture of healthcare in Grenada.
Yeah.
We must get to a stage where our patients can pull this mobile phone and see their entire medical history.
Yes.
And if they fall sick in another parish or overseas, they can pull it up and say, these are my drugs, even if they cannot speak.
Right.
This is the medication that I'm on. They should be able to use their phone and get the best medical care via telemedicine.
Yeah.
We should be able to stay at our casualty unit and speak to doctors in China, Australia, UK, or wherever. If we go doing a surgery or something and we need some assistance, we should be able to tell you the best in the world for the service that we need here. And that is why we are seeking this type of strategic alliance to help us to connect the dots, to deliver the best possible care to our people. Brother, this is a once in a lifetime opportunity. God has blessed this Grenada of ours. We have the opportunity to do this. And we have made, I consider, to be the very best decision. And this is what we need to do
Yes.
if we have to march forward.
No, some might say that it's a culture of bad health practices that we have in Grenada, especially with some of our young men in particular, right? Some say the whole culture of healthcare need to change instead of being reactive, but instead to be proactive. Because it's very evident that if you don't visit the hospital on a regular basis or check yourself, you might end up in a situation where you reach at a point that nothing could be done for you. So how are you planning to change the culture of healthcare, especially for the young men? Because we know the women, most of the times, they do their checkup and they do what they have to do, but a lot of time is the men. How are we thinking about changing that culture?
Junior, my friend, this is a huge problem.
Yeah.
Our men are dying privately and secretly
Yes.
because they fail to do the checks. You put aside that $200, and it doesn't even cost that much, but I'm just saying. And you go to the doctor, you may have to buy a little medication to just prop you up or whatever. And some of these doctors, they're telling you, and I'm talking the truth here, they tell you, look, you could use that herb if you want, kind of thing. You put aside that $200, you take a half day and you go and sit down by the doctor and you get a check to find out how things going. I'm guilty. I'll be honest with you.
Right.
But brother, you do that and you save yourself thousands of dollars.
True.
You do that and you put another 10 years on your life simply because you cut it early.
Yes. Yes.
We are feeling to do that. And we feel it. Look, some of us dreaming our problems. We dream it at nights. Some of us experiencing it in our bodies. We feeling the difference. We hiding it from our girlfriends and our wives and our fiance. We hiding it. We don't want them to know. And when water more than flour, they can't help themselves. My God. End of story. And the story has to be told anyway.
Yeah. But
There has to be a movement.
that's not only a Grenada problem, eh? I tell you that.
No,
Remember, former Roy Hastick, who was a good friend of mine, he was the head of the Caribbean American Chamber of Commerce here. He noticed that problem in our black community here in the US. And I remember he orchestrated a whole entire plan. And it said, women, take your men to the hospital. It's a whole plan of changing the culture in black men in the United States here. And people might say, America have all these facilities and all of these things. The practice and the culture still exists here. A lot of men don't go to the hospital. And that is a cultural problem that we find. I don't know if it's only in black men, but I know it's a problem. So that culture, I think that there need to be some kind of promotion, something, because if you could catch something preventively before it gets to the point, for one, it saved the country a lot. It saved the healthcare system. It saved people stacking up in the hospital. It saved a lot of problems. So preventative measures or proactive measures is what I think could help alleviate some of the stress on the healthcare system.
Well, yes, and to be honest with you, we don't utilize our health clinics in our communities and so on, and this is sad because we have good doctors and nurses there, and I know we have to do some upgrades with the facilities, and as a matter of fact, that is a top priority for us in 2025. But primary healthcare has to give top priority. Now, the exercising, the eating properly. Some of us want to eat 9 o'clock and 10 o'clock and go and lie down. And you know what that is doing? You think you're feeding yourself, you're not feeding yourself. You're feeding an illness, you're feeding a disease that you would have to cope with. But you mentioned overburdening the hospital, and that's a challenge because every time we overburden the hospital, we overburden our nurses and doctors and orderlies and support staff and what have you. And while the others in our communities stay idle. So this 2025 approaching by God's grace, we would do our very best to upgrade as many as possible those facilities. That is our number one priority because we and try to get them properly staffed, right? I've been speaking with some friendly governments, and I believe we're going to get a nice breakthrough in 2025. Also, we already have the funding. We have already set aside the funding for that. So that is definitely something that we're going to be doing. But overburdening our general hospital really creates a problem on the system. And those that are emergencies, just imagine if somebody goes in there because they had maybe just got a cut on the foot that is not too life threatening, and somebody comes in with a heart attack that is life threatening, and that's the last bed. Just imagine, right? Because Grenada is small, and those are we do have some realities that we are confronted with. I mean, I'm not saying that the doctor is gonna abandon you with a heart problem. Well, I'm simply saying it just put a lot of pressure on the medical staff, and so we have and the facility. So we have to be always mindful of that, and make good use of those centers. And so we're going to be doing our work to ensure that we can spread healthcare around the country, so that excessive pressure is in place on the general hospital.
Yeah, and a lot of people might say, look, Grenada have this world-renowned university, St. George's University. There are so much great doctors. In fact, I was at a hospital. I went. Okay, let me tell you. I for one, I do my check on a regular basis, right? I'm proud to say that the last check that I did, all my vitals came back really good. I was right I was in green. Everything was in green, and that was good because the last time I went before that, I had 2 or 3 that was yellow. I was in the yellow, going up above a little bit. So everything is in the green. I'm in good health. So I went to the doctor, and that particular doctor, he have 2 friends that went to school in the St. George's University, world-class doctors. How are we utilizing that? The fact that we have world-class doctors passing through Grenada. How could we use that as an advantage?
Well, let me tell you, whether we like it or not, well, yes, we need to utilize them, and we have been, because as I say, we have brigades that comes, world-renowned brigades that come, they work at the hospital and so on. And these doctors that pass through here, most of the times, they work at the hospital or do some private clinic and so on that assist in the whole delivery of service. But I want to say that make no mistake about this, the developed world, to a large extent, the medical, a lot of the medical staff
Yeah.
are Caribbean people, our sons and our daughters. They might have trained at the SGU,
Yeah,
and a
go ahead.
lot of those who are trained at the SGU serve in developed countries outside, and just a handful remain in Grenada. We train maybe more than 1,000 Grenadian doctors already, and nurses who work in the developed world. And truth be told, that these people are shoulder to shoulder to any one of the companions outside there in their field. So we have trained some good people. We have great resources. How do we attract them back home? How do we develop incentives in this land to build up our country? What do we need to do? And those are the questions that we've been trying to answer over the period, because we definitely have to develop incentive packages to get our nurses and our doctors remaining with us. We have to treat the profession, the health service sector, with a little more respect and recognize their contribution. And not just, I mean, we're talking healthcare today, but our public servants, our teachers, our policemen, you name it, across the board. I mean, they do not make the money in the public sector that they make in the private sector, but they stick with the government. They stick.
Sorry to cut you. Sorry to cut you. I have just a little bit of technical situation on my end right here. I am currently unable to hear any audio that's coming through the system. So let me just try to resolve that real quick. Stand by. You're watching Right Along Live, guys. We are speaking live here with the Minister of Health, Minister Philip Telesford, and just bear with me a quick second, guys. Let me figure out why I'm not hearing any audio that's coming through my system. I am not sure, but let me see if I could rectify this right now. You're watching Right Along Live. Please stick and stay. Hold on one second, guys. Let me try and see if this is the problem here. No, that's not a problem. All right, guys. Let me try restarting my mixing board. Let's take a quick commercial break and we'll be right back. You're watching Right Along Live. A lot of important questions and the phone line is going to be open shortly. Don't move. We'll be right back.
Time to do better. Beacon's Be Better Group Health Plan now offers new and improved options that make health insurance affordable for small to medium businesses. Good medical cover gives you a competitive edge and takes care of the people that take care of your business. Get a better plan to build a better business. Call Beacon or log on to beacon.co.tt for more info today.
Way to rent a car in Grenada? Welcome to Ride Car Rental, offering efficient, time-saving service with affordable rates and 100% paperless rentals. Whether you're visiting or need a quick ride, we've got you covered. Call now at 473-422-1011 and get behind the wheel today. Ride Car Rental, where convenience meets the road.
All right, Minister, could you hear me?
Yes, I can.
Sorry, can't hear. Okay, sorry about that earlier. I just lost audio completely. So I apologize for cutting you halfway in your thought right there. Before you go on, let me just take this quick call. This caller been on the phone line for a quick bit. Caller, you live? Where are you calling us from?
Good afternoon, Junior. My name is Vicklin,
Hey,
and
Vicklin.
I'm calling from Canada.
Canada, go right ahead.
And I would like to say a special good afternoon to Minister Philip Telesford. Hi, Philip. How you doing?
He-
Wishing you all the best.
yes. So
And
caller, you're
when
going to ask your question and then you're going to listen to his response on the live because there is no way to communicate with you and him with the setup that we have at our remote studio right now. So you could just ask your question and he's going to respond on the live.
Okay, my reason for calling Junior, I just want to congratulate the minister for coming on Ride Along this afternoon to give clarity based on many issues that is going on in Grenada. And as you know that the internet itself has made the world a very smaller place, though we are living outside of Grenada, but because of the information that is being advertised, spread on the internet, we seize and know and have a lot of knowledge of things that is going on. And when I saw that they're going to privatize the hospitals in Grenada, it brought to a state of panic. And it was very confusing. And I'm happy that Minister Telesford come to your program this afternoon, tackling it and letting us know, no, it is false, it is not true, and under no circumstances such will ever happen in our Tri-Island State, Grenada, Karu, and PD Matnik. And Minister Telesford, it takes a lot for you to come to face Junior because he asked you some tough questions. And we, the listeners who are viewing, are glued and we're happy for every clarity that you have shared with us. And thank you. Have a great afternoon.
Thank you so much,
Bye
caller.
bye.
We appreciate you so much.
Bye.
You're going to listen to the response on the live. Yes. Yes, Mr. Telesford.
Yeah, well, thank you, Vicklin. There's not much I can add except to say thank you.
Yeah. Yes, absolutely, absolutely. Guys, the number that you call, 718-701-5720, you could call us right now if you want to. I have a question for the minister in regards to any one of the topic that we spoke about here today. Let me see if I could take this call right here. Caller, you live? Could you hear me?
Yes.
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 Okay.
Absolutely. Absolutely. Guys,
Okay, caller. I'm hearing. I think I'm hearing an echo. If you could just
sorry.
turn your background down a bit.
I'm using two phones. I'm sorry.
Okay, no problem.
Junior, good evening. How are you?
Good, good, good. Go ahead.
Good evening, Minister. I listen to everything that you're saying. No disrespect. I don't think you know of half of the things that goes on in the hospital, and I wouldn't hold you to that. But let me tell you something. My nephew had a hernia for 5 years. He was scheduled to have surgery on 4 different occasions. And every time he goes down to the hospital for surgery, it's canceled, it's canceled, it's canceled. I knew nothing about it. The last time it was canceled was November of 2021. They called him at home, told him to come down at a certain time. There was a Chinese, it was a Cuban doctor that was going to perform surgery that day. And his name was put on the list. He went down there 2 hours before the scheduled time they told him to get there. And when he got there, they told him that the surgeon left for the day, as if he was late, but he was 2 hours early. Now, he reached out to me and what are they giving you? They keep giving him painkillers. He got immune to it. Imagine you're taking painkillers for 5 years, the hernia. He got immune to it. So I reached out to the Ministry of Health, and they just tossed me all over that department. I asked to speak with the Minister of Health. They transferred me to his secretary. The secretary took the information. She also said to me, send an email. I have the email trail. You think I'm lying? I could forward the email 3 times. No one responded to me. I reached out to the medical director. When I spoke to the medical director, gave the information, she went and she pulled my nephew chart, and she saw everything that I was saying was true. He was scheduled. He was canceled, no reason, and they never called him. Within 2 days, my nephew was scheduled for surgery. And, he had a successful surgery. But I shouldn't have to, be the one to call and say, listen, you guys have to do something now or else. Once I say or else, then everybody jump. So something needs to be done with the workers in the hospital. If my nephew has to stay with a hernia for 5 years and in pain for 5 years, something is definitely wrong. I thank you.
When did that happen? 2021, you said?
No, so the last scheduled date was November of 2021. 2022 is when he had the surgery.
Right. Okay.
Right? He had the surgery March actually of 2022. Right? So that's how many years before my nephew had the surgery.
Right. Okay.
And if you have a hernia as a man, what's going to happen to you? Who knows if you could have kids?
Right. Minister, you could respond to her because she's on the phone line. If you want to say something, call her if you want. You could just wait and hear the minister's response.
Okay, no problem.
When it comes to sickness and death, I'm always moved with compassion, right? And yes, she did say 2021, but what this highlights is a systemic problem within our system. And there could be a number of reasons why those rescheduling might have happened, right? And I'm not to make excuses for what happened under a previous administration and trying to excuse our way out and try to reason out these things. What we need to do and understand, solve these problems. And that is why to get
Hello, is the program Ridealong?
Caller, hold on 1 second. Sorry, Mr. Minister, go ahead. Sorry.
Because you may have the doctors, you may have the medication, you might have the equipment, and everything's ready. But if you don't have an anesthesiologist to help you through the process, then you still cannot perform the surgery. And so many things can go wrong. And that is why we have deliberately set out to have these experts on hand. So we have at least 2 that are coming to Grenada to work for at least the next year, to work with us in our system. And we have a local graduate who will be coming back soon also. So we're going to have at least 3. And those are the things that we must do in order to solve these problems. So I hear her. Let us not have the 2021 issues repeat themselves in 2024, because we have to learn from our mistakes. I want to assure the public that we are doing everything in our power to solve these problems. As long as those problems come to my knowledge, I will not rest until those problems are resolved. And we are working on it. I can assure you, we are working to improve our service at those units.
Absolutely. I believe we have another caller on the phone line. Caller on the phone line, are you still there?
Good evening.
Yes, I'm here.
Okay, no, caller on the WhatsApp. I'm gonna come to you next. Sorry about that. I'm gonna come to you next, Sherry, on the phone line. I'll be taking the call on the phone, and then I'll come to you. Sorry about that. Yeah, caller on the phone line. Go right ahead.
Good night, Junior, and good night, Minister Telesford. How are you, sir?
I'm doing well.
I am calling to. Hello, you hearing me?
Yes, go ahead. Where you calling us from? By the way, where you calling us from? By the way, caller.
I'm calling you from there. I'm calling you from Grenada.
Grenada. Okay, go ahead.
Jealous Mountain Ridge, Monjolu, in other words.
Okay.
All right. I'm in minister's constituency. So, listen, I applaud minister for all he's trying to do with the medical system here in Grenada, but he's got a gigantuan task to take on. And as Africans say, to eat an elephant, the only way to do it is to take it one bite at a time. And I applaud him for all the efforts he's trying to do. However, I have experienced the medical system in Grenada firsthand. I have experienced it with just recently, like 2 weeks ago, and it leaves me very wanting to scream. But I'm going to control myself this evening. Minister, I think the majority of your problem in the hospital is the people that you have employed in the hospital. Now, if you go into the hospital and you're ill and you're sick and you're in pain, you as the practitioner have to extend courtesies beyond the normal, because the individual you're dealing with is going to react based on their pain they're going through. They're scared, they're frightened, and they are in a very dark place. So you have to understand that and use your emotional intelligence when you're engaging with them. You cannot, oh, if you don't do this, you do that, and you have to go, and then you can't come back, and all of these things. That is
Right.
not appropriate discussion to be having with the individual. That time when you're going through it, the people have to do it. And if it's training or retraining that it needs to be take place, you need to do that house. Minister, I think we need to go back to educating our people from stage one, from the time they are boys, primary school and up. Educate them on taking care of themselves.
Right.
Yeah. I grew up with my great grandmother, and I got bush tea. I was even taught how to bathe myself.
Right. Caller, you
I
got
was
to wrap it up a
taught all
bit.
of that
You got to wrap it up
by
a bit
these
because we have a lot of calls on hold.
Yes. So I say start with education. Educate men.
Okay, I think we lost that caller there. But start with education. That was the point that he was making in his articulation. Minister, can you respond?
Junior, I want to say this. This bag of apples,
Yes.
there's some good ones and there's some bad ones. I think what we need to do is that throughout the medical field, people should wear their name badges.
Right.
People need to be identified,
Yes.
right? We need to be able to treat with these things when they come. We cannot paint every house in the same color.
Right.
I believe, based on what I've seen and heard, 95% of our practitioners are good, excellent, and mean well. They are a minority that needs to check themselves.
Right.
And let us be frank about that. And they know who they are. And maybe they have their own personal grievances. And if there are grievances that they may have that cause them to act in a particular way, let us talk about it.
Right. Right.
Find a way to exit out of the system if you can't work in it.
Yeah.
When it comes to delivering healthcare, nothing, absolutely nothing, should stand in the way of delivering top quality care to patients.
Absolutely.
Doctors will require a doctor at some point in time. Our orderly will require a nurse. Our nurse will require a doctor at some point in time in our lives. And when you are sick and can't help yourself is when you need the support mostly.
Yes.
So let us be clear. These people, God forbid, who may not have the best intentions, if that is the case, they need to be identified. And also, those who are doing an exemplary service must also be identified,
Yes.
ended, rewarded, and awarded for the service to humanity. So I would say we have to start wearing our name badges. And when I will call upon the Grenadian people, to identify those who are doing well and speak about it. Speak about
Yes,
those who are doing bad. Let us also deal with them
I agree.
because we cannot afford to allow this beautiful island to degenerate any further. We met healthcare in a mess. We cannot leave it in a mess. It's only up from here. We can't go any further down. I'm the first to admit healthcare is in a mess. It's not a pretty picture. And I'm in the middle of this thing. And we have to strategize our way out.
Right. Okay. We got a caller on the WhatsApp. Let's go to Sherry on the WhatsApp. Sherry, you live?
I'm alive. How are you doing? Yes. Good
Good, good.
evening, Minister. You hear me well?
Yeah,
You
he
hear
could
me
hear
okay?
he could hear you. Well, he will respond once you ask a question on the live because you're on the WhatsApp.
Okay. Well, it seems to me, Junior, all of a sudden we wake up from a dream and everything have to be done in 2.5 years. But I want to tell the minister, thank you for what you have been doing. It's not an easy job. We don't understand that. And I think you all are trying your best to see how things could be better. And I'm really praying for this government because it seems as in 2.5 years, everything have to be done now. I remember before the former Minister of Health, Nicholas Steele, they had a placard up about fixed health care. We come down 2008, nothing wasn't done. 2013, nothing wasn't done. 2018, nothing wasn't done. And we come down. And all of a sudden, we wake up now, and everybody want everything to be done now. Now you're going to take your time, and you're going to do what you have to do, forgetting all the naysayers. And please be careful. There is a lot of wrong peg in square hole or square pegs in wrong hole. Be careful. There's a lot of people inside there on all the ministry that's trying to sabotage and just trying to do a lot of mischief. Please open your eyes, spirit of discernment, and some things have to be done because they want the government to look bad because a lot of people are undermining the system to make the government look bad. I know you know Christ. You know how to pray. But there's a lot of them inside a day. And you have to watch them very carefully. You all are doing a magnificent job. Continue. Everything's going to be all right. We cannot go and put an old hospital where our next one was. We should have moved. They should have moved that hospital. Same entrance, one exit, one entrance. When sirens start to blow ambulance, you don't know where to park your vehicle. Go back in the same place and put a hospital in the same place where our next one was. Rusty and everything. Bed rusty, stethoscope rusty, everything rusty. And know who they want to blame. Take your time and do your work. God will see you all through. Amen.
All right, thank you, caller. Appreciate that comment. Minister?
Well, all I can say is thank you, caller. Well, she's speaking the truth. If you notice, Junior, when you told me I was coming to court,
Yeah.
I didn't come here with a bag of excuses and I didn't play politics.
Right.
You didn't dance around your questions. I answered you straight as you asked me. Because the truth is, it is bad and we have to find solutions. That's what we hired to do, to find solutions.
Yes.
And that is exactly what we're doing. Now, in remedying solutions, you can't just come out and just say, we are going to do this, we're going to do that. There is a process, there are a number of stakeholders involved in health. So therefore, we must meet with our stakeholders. We must discuss with our stakeholders the things we are going to do. And the first set of stakeholders we have are our staff.
Yeah.
Nurses, doctors, orderlies, biomeds, cooks, you name it, cleaners, the whole gamut of staff. Meet with them. And tomorrow, please the Lord, I will be in the afternoon time after Parliament. I will be meeting with the staff at the hospital. And there are a series of meetings that we've planned with them because we have to share with them where we're going, what is the vision for healthcare in Grenada, so that we can move together, to build together. Our attitude has to be fixed. our approach to healthcare has to be modified. This is our beloved country. This one is not about politics.
Right.
This is life and death.
Absolutely, absolutely.
So we got to fix this thing.
We have so much calls on hold, Minister. I even have two calls merging here. Sorry, my throat. So let me see if I could open up the phone lines. Caller, you got two calls on merge. Could you hear me?
I'm hearing you.
Okay, let's go with you first, and then we're going to take the next person that's on merge call on the line. Go ahead, caller, with your question. Where are you calling us from?
Hello, everybody. I'm calling from New York.
New York, right ahead.
And first of all, I'd like to, good afternoon, Minister. Good afternoon to the general public listening. First of all, I'd like to commend the Grenada Health System for taking a right step in the direction for seeking international help. But I have a question. Why is it that we need an international agency to tell us what our needs assessment are? Doesn't the health system have a quality department that conducts audits in the health system that can produce such reports to tell us where the flaws or the areas of assessment or improvement that we need? That's question number one. And question number two, I would like to know if the minister has plans in making the healthy public policies public to the general public of Grenada. Thank you. These are my two questions.
Thank you, caller number one. Minister?
Yes. Well, I answered the last question first. We will do a rollout of our plans and policies for healthcare. So you get that. You'll get some before the budget and some during the budget, but you'll get them all. Your first question, in terms of our audit department, we work very close with our regional and international partners, and so we do have a very good sense as to where our gaps are locally. Now, if we want, and I'm talking here strictly professional now, if I put myself into the position of those who are coming in, those who are coming in must first recognize and study the history of the organization, what brought us here, where we came from, the culture of the organization. How do we do business? Who are these people? How do they function? What are their values? We must also study the management style. What style do they use in solving problems? You must also study the policies, procedures, and strategies in order to determine what are they employing in the current circumstances. And then when you understand that, you measure it up against what is international standards in every respect. So you cannot change history, but you might have to change a culture. There has to be, more likely than not, be a cultural shift. There would have to be a management style shift. How do you employ cultural change and management style change if you have to deliver the service that is needed? So that is why the consultants who are coming in to work with us must do a gap analysis in order to be able to map a way forward in solving our problems. So that is the explanation for that.
Okay.
It must be done that way.
All right, so let's go back to the caller number two. I see a number of calls coming in. I'm going to really try to get to you guys as much as the minister permit the time. So we got another caller on the line. Caller on the phone line. Go right ahead. Be brief as possible, please. Thank you so much.
Hello?
Hi, caller. Go right ahead. Where you calling
Hi,
us from?
Junior.
Where you calling us from?
Hi, Junior. Good afternoon, and good afternoon to the minister. I'm calling from Grenada. How are you?
Good, good.
I'm doing well, thanks. Yeah.
Okay, good afternoon to you, Honorable Telesphone, Honorable Mr. Telesphone. I'm calling to say that, Mr. Telesphone, you all are doing an excellent job. Now, I would say that you cannot fix everything in 2.5 years. You met the hospital in a mess, and the former prime minister, the former government, they did a lot of mess. And you all cannot, common Grenadians, we cannot expect for this government to come in and fix everything in 2.5 years. I am not in support of that. I think that Mr. Honorable Telesford is doing an excellent job. I think that he is trying his best. The government is trying his best to bring back health care in Grenada, but it takes time. Everything is a process. You understand? And we as Grenadians, we have to be honest in our minds. We have to be honest. Let us not look for political mileage. Don't look for political mileage. Let us look at beyond, trying to transform this nation. And I think that Mr. Telesford is doing a very, very good job, an excellent job. And Honorable Telesford, let me tell you something. Don't sorry for Magadag, because Magadag will turn around and bite you. And let me tell you something. You have a family. Don't lose your sanity for we ungrateful Grenadians. That's my point, Junior. You have a pleasant night, and I enjoy Ride Along all the time. I always listen to you.
Thank you
But
so much.
Honorable Telesford, just do your best and just do it with a cool heart, and God will see you through. But don't sorry for we Magadak in Grenada. We're very ungrateful. 2.5 years is not enough for you all to prove a point. I'll go in there 10 times. We voting all you in. Have a good night.
Thank you, caller. Thank you so much.
Thank you.
Yes. We have another caller on the line. Let's see if we could take that caller on the WhatsApp. Caller, you live. Where are you calling us from?
New York City, good evening all. Minister Junior, greetings. It's a big topic, and I just have a couple quick questions I want to throw at the minister. Regarding this healthcare, it's a good initiative to move to Mount Sinai. I'm just wondering though, I'm not hearing, maybe I missed it, I'm not hearing the integration of the public in this in terms of a government meeting, consultation, getting the feedback from the public, because at the end of the day, it's the public that's being directly affected. So they are a major stakeholders, and they should have a say in terms of documenting their concerns and how they like to see things evolve. And just two quick questions with the Mount Sinai deal. Who's paying for this, and what's the duration of this arrangement? Thank you.
All right. Thank you so much, caller. You listen to respond on the live.
All right. Thank you, caller. All right. Recognizing that this indeed is important. If you're sick, we need a doctor. Healthcare in Grenada is sick. One of the principles in medicine is that you cannot prescribe medication for yourself, neither your family. You got to get a third party. And that is exactly what is being employed in this situation. So as far as who is paying for this is concerned, I wish we could get somebody who will do this for us free.
Caller, hold on 1 second. Go ahead, Minister.
But that's not the way the world goes. We have to pay for it. So the government and people of Grenada are the ones paying for this. All right. The arrangement is an 18-month arrangement. And I say this up front, I don't know that we can solve all of our problems in 18 months. We're talking about healthcare. We got to be patient. We got to be tolerant. I say to us that there will be changes. There must be changes. I ask us, please, let us not cloud the issues regarding healthcare in Grenada. Let us work together. Let us draw from these professionals who will come in to support us. Draw from them as much knowledge, learn from their experiences and their stories, and let us develop our people and our system. If we can do that, we get a win. If we can come out in 18 months with a win, I'm cool. I'm cool.
Okay. Okay, we got another caller on the WhatsApp. Let's take a call on the WhatsApp, and then we're going to go to the caller on the phone line. Caller, you're live. Where are you calling us from?
Hi, good night, Junior. I am a regular caller calling from Jamaica. Three things I just want to ask. First, I don't know if the minister spoke about it before I joined the program, but the health insurance. We have been hearing that something was in process with this since in the last administration. I had asked about it in one of the town halls and the Prime Minister spoke about it, but as of now, where are we right now with the health insurance for the nation? Two, has the minister ever thought about putting out a list of professionals that we need in the healthcare system? Because there are some professions that maybe because of lack of experience or exposure, some Grenadians are not aware. For example, medical physicians, biotechnologists, all of these stuff, oncology, nurse, and stuff like that. Have they ever thought about putting out a list of professionals that they need more individuals to study so that some Grenadians can be more specific in choosing the area to study? And I don't remember what was my last point, but I know a lot of people are calling. So just those two things, and
Thank you so much. Thank you so much, caller. Thanks for being brief as well.
Yeah, that's great. Yes, we'll publish that list. We do have a list. We have some new frontiers being opened up for 2025 in terms of scholarships. I know it's a sort of tricky one because those who are doctors, we want them to specialize in some areas, so some of them may have to leave. So we'll publish the list so that at least they can look at it and we decide how we treat with it. We can't do all in 1 year because we can't allow everybody to go all at once. But there's some new frontiers that is being opened up for scholarships. So I'm very excited about that. Very, very excited about it.
Absolutely. And the health insurance question.
Yeah, sorry. Yeah, so the health insurance, according to our plans, by the end of 2025, by October 2025, we should have all things set in place for the activation of health. Sorry, I'm so sorry. For the activation of national health insurance. We have done a lot of stuff. We have the draft legislation and the draft policy document, which is currently being studied by legal affairs and the team. So we hope within a couple of months or so, we should, I would say by the turn of 2025, because I'm looking at budget and all sorts of things based on our schedule right now, it might not be possible to be able to come back to that, to finalize that, because it's a huge document, because we had to do some trimming and all of that to it. Let's say by the end of the first quarter in 2025, these are two huge documents, and we have to be very careful as to how we implement and so on. So it will take a little while, but we are in the middle of that. It's something that is on the front burner, but it's a very careful process. All right, so we are definitely working on that.
Absolutely. Take another caller real quickly. Caller on the phone line, go right ahead. Tell us where you're calling us from.
I'm calling from Grenada.
Grenada, go right ahead.
All right. Good evening, Junior, and good evening, Honorable Minister. I'm calling to say that you are doing what you all are trying. I don't expect everything to fix in 2 years. I went into the hospital last month with my daughter, who is asthmatic, and I was very happy, was lit to see that you all have an asthma bay.
Yeah.
I've never seen that before. There was an asthma bay with 5 chairs, 5 new chairs. There was a new bed, a lot of new equipment. I went in, My daughter, I went into the emergency. My daughter went in around 2:50 thereabout, and in 10 minutes time, she was inside to see a doctor. Before you know it, she was on the chair and she was nebulized. I was very impressed with the service. All right. So I know you guys are trying. There's a lot more to do. There is a lot more to do, but I can see that you are trying. The customer service with the nurse and the doctors, we need improvement there. A lot of times you don't want to ask, people feel uncomfortable to ask questions. Doctors and nurses, they have to make it more accommodating for people wanting to ask questions. I've been in Kings County with my daughter, and nurses, doctors are always asking you, "Are you okay? Mommy, you have any questions?" We have to get to that place where we can ask questions and feel comfortable to ask questions and not feel intimidated. So I know you all are doing, but we still have a lot more to do. But I congratulate for what you've so far and continue to do, and let's try to see if we can get to that point where we will be excellent. So I applaud you all for what you've done so far and continue to do. Thank you.
Thank you so much, caller. Appreciate your call there. Yeah, Minister, I take your whole time, your whole evening, right?
Yeah, and I have to go and visit a
Oh,
sick friend.
okay. So could you give us about 10 more minutes to take about 2-3
Yeah,
more
go
calls?
ahead. They
All
know
right.
I'm coming. They know I'm
All right,
coming.
okay. He's on his way. He's handling some very, very important issues right now. Caller live, where are you calling us from? I think the caller just hung up. Okay, that caller was on the line for a bit. 718-701-5720, guys. Calling quick. Okay, I got this other call coming in. Let me take this call. Caller live, where are you calling us from?
Grenada. Good night, Junior. Good night, Mr. Telesford.
Yes, go right ahead, caller.
2 points. I want to urge the minister. The point he made about name tag for healthcare workers is very, very important. Because you see what happens, people need training, but then you need some people to be targeted training. Because not everybody have the same level of customer service and empathy. So he needs to stress that name tags are necessary, from doctors to technicians to kitchen staff, whoever they may be. Because at the end of the day, there need to be job analysis, evaluation for healthcare workers. That is how you will be able to train people and target specific training. You're not going to be able to give the training you need for a nurse to a kitchen staff. So you have to know what kind of training you need for specific people, and you need to target these people, one. Secondly, I recommend medical recording. There need to be, in this age of technology, this thing about paper and you had to go across the road to get a file for a patient because you didn't know that person was going to see the doctor. We had to do away with this thing. You're talking about modern day medicine. You have to think technology. You have to be efficient. You have to be effective. You need to train people to be professional in medical recording. And there's a profession for that. There's a degree for that. So we have to look at that when you do your gap analysis and know what your needs are for the 22nd century, not even the 21st century, because things are moving so quickly. So these are my contribution. Also, Junior, I have been going to the hospital almost once a month with a relative, and I could see some improvement in the outpatient clinic. I am so very pleased. I've never seen that before. But again, the system of electronic data for patients will speed up the whole process. Thank you. Good night.
Thank you so much, caller. Appreciate that. Yeah, it's a work in progress, Minister. Definitely a work in progress. We'll take 2 more calls, 718-701-5720. We're speaking here with Honorable Philip Telesford on the topic, of course, of health. I just want to say about the nurses and doctors. I mentioned earlier an incident that happened in Karu while I was there a few months ago. And I have to say kudos to the doctors. That was before Barrow. But kudos to the doctor in particular and the nurses at that hospital in Karu. I said I will personally make a donation to the hospital. I'll do even one better. I'll do a program dedicated in raising funds and getting donation for that hospital in Karu in particular. I mean, straight out to Grenada, Karu and Pitimatic need it. But the efficiency that doctor worked, I mean, I was in awe. He dedicated, and I could see he had real compassion. And those are we don't hear about those type of compassion. You only hear when they say doctors do this or nurses do that. That doctor had true compassion, man, and he handled his job with pure skill. And I have to say thank you to the doctors and nurses who go above and beyond to provide these services. So it's not only always a bad news. It's sometimes it's good news that we need to give out there to the doctors to even boost the morale. We got another caller on the line. Caller 11, where are you calling us from?
Good night, Junior. I'm calling from Grenada.
Grenada, go right ahead.
Good night, Minister. I just have a concern. Since after the Hurricane Ivan, Branch Grove Medical Station been in a house. They've been renting a house for the medical station, and they never did anything again. So I just want to find out if the minister have anything planned to do Birch Grove Health Center again.
Thank you, caller. Appreciate it. Listen to his response on the live. Birch Grove Health Center.
Yeah, yes, sir. That is definitely on our agenda for 2025. Under the Health Strengthening Project, we are definitely going to do that. It is definitely on our agenda.
Right. And how has the facilitating the hospital and the healthcare facilities in Karu post-burial?
Well, we just completed the hospital. We have the 4 within a week or 2 maximum. Let's say a week and a half. We should start the other 4 on the island of Karu and the 1 in Petit Martinique. We had to try to find an alternative location. We've tried a number of potential locations to relocate the center in Petit Martinique. We have not yet been successful, but definitely within a week and a half or so, we should begin works on those 4 in Karu and the 1 on Petit Martinique.
Yeah, great. Listen, Minister, thank you so much for coming on. And I really urge you and other members of the administration to be more proactive with information, because I think that when we let things mount up and we don't see a lot of the ministers in a long period of time, people have so many questions, and that builds myth and miscommunication and misunderstanding and all the misses that you could find going down the road there. So I say the same to you as I say to the opposition. They never take me up on it, but I say the same thing. This is an open forum. This is an opportunity to talk to the world. We have thousands. By the time this program finishes, we're probably going to have 30, 40,000 people that watch the program, which probably about half of the population in Grenada would have watched this program, if not the entire population. So we need more active engagement, and we open at any point in time to have that discussion right here on the Ridealong platform. So we appreciate your time on here today, sir.
Thank you, Junior. It's never a pretty thing sitting in a courtroom and feeling questions.
You did well.
But I thought just speaking the truth as it is, I think is better than trying to dance around it and try to color it. But I'm excited. I know it's tough. It's difficult work, but I'm excited on the road ahead, because I know at the end of it, there is going to be some rejoicing. The process is painful. Being told that, healthcare has not been improved for the past 2.5 years is a fact. It has not been improved in the way that you would expect to see it. There's some small signs, as pointed out earlier, but what we really need to do, we haven't really done it yet, but we have done all of the planning, all of setting aside the financing and getting the financing and all the stuff that is needed to make the big decisions that are to be made. And so I am satisfied that the foundation for the takeoff has been laid. The next step is to start laying those bricks, and it start one brick by one brick until we get to where we want to go. But I can tell you, 2025 is going to be a wonderful year. And I'm also excited about what we're going to do in Karu in terms of the 5 centers that is going to be renovated. Those works are going to be started very soon. Actually, 3 in Karu and 1 in Petit Martinique, because the other one it's in good order and condition as we speak. Yeah.
Before I let you go real quick, I saw this circulating. It's been on media. I almost forgot to ask you about that. But there was some talks about some issue problem with the CMO and the minister. Any truth to that story? It was on front page.
Well, sometimes I have to laugh. I to be honest with you, I'll tell you the truth. When I saw it, I pick up the phone and I call the editor of the paper. I said, "Where this is coming from?" The response was, "I'm a journalist, meaning I'm free to write what I want to write."
Oh,
right? I mean, you look at this, for example, the privatization and where these things come from. Where these things really come from. Brother, we have, for me, as a minister of government, I believe I recognize my calling. And that I'm doing just that. This is where I'm placed to function at this point in time. And I'm keeping my focus, right? I am not at odds with anybody at all. And I am a plain speaker. People who know me. I settle for certain standards. If you are not doing what you expected to do, I am definitely going to tell you. Whether you like it or not, I'm going to tell you what it is. So I don't know, because people may hear and see things and twist it and turn it to suit their fancy. But that is life. And as a politician, you have to know that these things are going to be said.
right.
And as I say, there is a factory. There is a factory in Grenada. I don't know where it's located. as as election time period comes in, you'll see a lot of Nancy stories. They're going to fabricate all sorts of things. But let me just say, this is Cancer Awareness Month. We got to approach it. We got to educate ourselves, do our early checks. I'm wearing my pink. Wearing my pink.
Yeah.
So I want to tell all my brothers and sisters out there, let us do our checks. Early screening prolongs your life.
Yes.
Earn life credits.
Yes.
You can earn 10 or 20 or 15 years more in your life by simply catching it early. And our race, this color skin,
Yeah.
is susceptible to these types of illnesses.
Yes.
Prostate, breast, lung cancer, all kind of different cancers. Check it out early and save ourselves unnecessary expenses. And when we get these things, it drains the family financially.
Absolutely.
It saps the last dollar from the family. So you gone, we had to spend maybe close to $20,000 to bury. And then those who are behind, they are stripped of every cent in their bank account.
Yeah.
Really bringing misery on the family. And again, that's another reason why national health insurance is so important. But let us be aware. Cancer Awareness Month, and let us educate ourselves and do our screening.
We've been playing our part for cancer awareness for the past 6 years. We have been actively donating and conducting march here in the U.S., raising so much millions of dollars for that cause. We're hoping that we could do the same in Grenada as well. Probably we could do the same thing in Grenada, but we do have a march on the 27th here for a ride against breast cancer. So we are actively asking and begging young ladies to do their mammogram, do their checks. It's very, very important. Before I let you go, Minister, sorry, but I had to find out about the status of Mr. Damon Cloudon, the young man that fell off the roof in Karu. And if you want to touch on it quickly, sorry I have to keep that one for last, but it's an important topic.
Right. Well, firstly, let me express best wishes for his continuous recovery. I must say, I'm very proud of our cooks, orderlies, cleaners, nurses, doctors, support staff at the hospital. This particular case drew my immediate attention. And I visited with the patient at hospital, I met with him, I met with his mother and so on. But he didn't know I visited because he was asleep. But that we must remember, when that patient was admitted to the hospital, he didn't even know himself. He was intensive care for a number of days. And the hospital was able to nurse that guy back to life. Despite everything else, he was able to be nursed successfully back to life. I think he spent close to 20 days or so at the hospital. So he survived for that period of time. And he was able to be successfully flown out of Grenada. The medical staff has done a remarkable job, putting aside all the frills regarding the raising of funds and everything else, being able to come from death to life. I celebrate with him and his family life. He's gotten a second chance. I thank God Almighty for having mercy on him and for saving his life so that his little children can grow up with their daddy and that his wife can live in the comfort of her husband, and that mommy can still proudly say, my son is alive. I thank God for his life, and I think he has a rich testimony to share, how God has saved him. And let us continue to pray for him and his family, and lift them up so that he get complete and total recovery from this condition.
Thank you. Thank you so much. Minister, we'll keep in touch.
Yes, you're welcome. Take care.
All right,
Thanks
guys.
again.
No problem, man. No problem. Guys, we'll be chatting there with Minister Philip Telesford, going through a number of things. Hold on one second, guys. For some reason. All right. The music is not playing where it's supposed to play. Anyway, let me play it from here. I must say that I want to thank the minister for coming on and chatting with us. And I invite him to make it a more regular occurrence, not only on Ride Along, but there have to be administration. I understand that there are so many things, and media appearances may not be. I mean, if someone is dying or someone need immediate assistance, media appearance may not seem to elevate itself to the top of the priority list. But he did take the time today to extend almost 2 hours on the program, and we invite him and other members of the administration to be more vocal in terms of showcasing what they're doing, not only on Ride Along, but other platforms as well. We appreciate that. Guys, let me go before I go on a break. I got to tell you guys this really quickly. We are doing some brand new things, right? We are doing some brand new things. And Ride Along always in the top of innovation. So we are launching our Tuk Tuk rides, right? So this is not only for tourists. We have, thanks to my brother Richard Nixon and the folks over there at Hideaway, we're able to secure this 4 really nice Tuk Tuk that we're going to start engaging in tours. It's going to be around, not only catering for tourists, but for the entire Grenada population. So you have a girlfriend, a boyfriend, you want to take them out on a really nice rum punch cruise, we're going to be affording the opportunity to have these tours. In addition, guys, to facilitate that, we need to employ people. We need to employ a full dedicated staff, right? This is a customer service job. But first, you need to have your bike license. So if you have your bike license, or if you want to join the Ridealong staff, the team of tour operators, of course, you know, we have the ebike, now we have the Tuk Tuks, we have the Ride on the Sea, all of those things that we're providing, it is essentially providing employment opportunities. We also have the Ride the Waves guide. Those are the Ride the Waves that are going to be on Granite Beach, are going to be taking people around. We need hardworking, dedicated people to join the team. No, I am a very strict boss. I might be on the program, you guys may not see it, but I'm a very strict boss. And when I say I need dedicated people, I'm very tough and hard on customer service. So everyone that we bring on board have to undergo a customer service class, have to be trained in CPR and first aid. So you must have to subject yourself to being ready and able to do your customer service class and first aid and CPR. If you want to join the team, you have to email us your resume. Now, if you say you don't have a resume, create one. All right? You have to take the time. If it's something that you want to do, you have to take the time and the opportunity to go for it. Now, when I told people yesterday that we're employing people to do this and they need to have a bike license, some people want me to tell them where to go to get a bike license. How much am I going to pay for the bike license? Listen to me. We are providing a good salary base, including commission and tip. So you will be well off, right? You have to put yourself in the position to accept this job. So don't message me and tell me to point you to where you need to go to get your bike license. Get your bike license. You are sure to be employed because there will be so much things that we're going to be needing. We're going to need people. You go get it. You send in your resume. If you don't have a resume, create a resume. Get somebody to help you create a resume. But rest assured that we're not going to just hire you because you have a resume. And people want job, but they don't want to work. You're gonna get fired. Because if you're not providing the service properly, that is to our mandate, we will get rid of you, right? And we don't play in terms of customer service. So all of these things that we're providing, we have an increased amount of e-bikes that we're going to be bringing in as well. All of these things, we need staff, dedicated staff. No bullshit, all right? No bullshit, no bullshit, okay? Also, guys, I got to tell you about, if you're looking for a car rental, we have that too, right? We have that too. And coming down for the Christmas season, everybody looking for cars. If you want to rent a car, give us a call. We have cars, we have SUVs, we have CRVs. We'll tell you about how you could rent a car to get around for the Christmas season. Or no, you could call anytime. Call us 473-422-1011. We'll be right back.
To rent a car in Grenada? Welcome to Ride Car Rental, offering efficient, time-saving service with affordable rates and 100% paperless rentals. Whether you're visiting or need a quick ride, we've got you covered. Call now at 473-422-1011 and get behind the wheel today. Ride Car Rental, where convenience meets the road.
What if you had a choice? A choice of joining a line or a choice of making your purchases online? What would you choose? While you ponder on that, the National Lotteries Authority has provided another purchasing option. All their games are now available online. Yes, Grenadians! From wherever you are, purchase your favorite daily and jackpot type games using any electronic device. Register on the NLA's website at www.nla.gd. Top up your account and enjoy online lottery gaming at your convenience. We're taking shopping comfort up, up, up several notches. But the choice is yours. Join a line or buy online. NLA, make your dreams come true.
Time to do better. Beacon's Be Better Group Health Plan now offers new and improved options that make health insurance affordable for small to medium businesses. Good medical cover gives you a competitive edge and takes care of the people that take care of your business. Get a better plan to build a better business. Call Beacon or log on to beacon.co.tt for more info today.
Pick yourself up with Ride Rent a e-bike today and take advantage of the smartest and coolest way to get around. Rental starting for only $30 per hour and less than $100 EC per day. Zip through traffic, save money, and look awesome doing it. Check us out at the Esplanade Mall today. Visit us online at ridersebike.com or give us a call at 473-422-1011. Your wallet and the planet will thank you. Ride Rent a e-bike.
Once again, well, we'd like to thank the Minister for taking the time to chat with us here on Ride Along Live, where we chat everything, man. It's an open platform, as I said. Okay, oh, guys, listen. If you need to rent an e-bike, we've been telling you this is the way to get around, eh? Don't worry about the gas. Don't worry about gas. Get an e-bike. Get around town. Or if you have a family and a group of friends that's coming in and you want to take a nice little ride, get an e-bike. Take them out on a nice little excursion ride. All right? For more information on that, you can call us at 473-422-1011. That's 473-422-1011. Feel the light. Global love taking flight. Guys, are you looking for a t-shirt printed in Grenada? Yeah, well, if you are, we have some immediate and quick and instant solution for you. Instant, yeah. Check out Instaprint. Instaprint Grenada. Give them a call in Grenada at 473-422-1011. We also have a location here in New York. We sell blank t-shirts from 1 to 1,000. It doesn't matter. Give them a call right now. Instaprint Grenada. As I was telling you guys earlier, our brand new Ride Tuk Tuk service is coming, and it's not only for tourists, guys. It's a tour. We have a series of tours around Grenada, in St. George. It's really nice, and this is something that's all over the world, guys. This is not new to the world. This is something that's happening all over. I've been to every country I've been to have this, so we decided to bring it to Grenada. All right, so this will be our own Tuk Tuk ride, branded for visitors and locals alike. All right, let's ride Tuk Tuk. Don't forget also, if you want to get on staff with us, you need to have your bike license, and we'll take you through the process of getting on board with Ride. Amazing host leading the ride. Power to the people we shine. Giving fans what they need. Coming soon, we do have the Ride the Wave. Yeah, man, you can ride on the waves. Take it right to a whole new level, guys. Yeah, our paddle bikes are gonna start our first set of rides early next month. We'll tell you more about that. Ride the Wave. The ultimate ride, guys. If you want to ride to Grenada, you got to get on JetBlue. JetBlue.com. Check them out online right now. JetBlue.com. Book your flight to Grenada and the Caribbean with JetBlue. JetBlue.com. Every ride is sheer delight. Making waves across the seas. Love and joy in the breeze. Ride along live if you please. Bringing hope with such ease. Ride along. Join the dance. Let's sing the song. Island to island, strong with the host, we belong. I told you earlier about the car rental. Yeah, give us a call if you want to get a car rental in Grenada. Call 473-422-1011. from SUVs, CRVs, small cars, all available from Ride.
Bringing hope with such ease. Ride along, join the dance, let's sing the song. From island to island strong, with the host, we belong.
Guys, thank you for watching. Thank you for being a part of our program. Don't forget also, if you have a Fire TV, you have a Fire Stick, you can now download, well, this has been around for a while, but you could download Ridealong Live onto your Fire TV. Go to the App Store, Fire TV Store, and just type in Ridealong Live. Download the app and you got it. Watch Ridealong Live on your TV. Over 50,000 downloads. Wow, we're moving up, guys. Download it onto your Fire Stick. It's Ridealong Live on your Fire TV. Thank you for watching. Thank you for being a part of our program, guys.
Worldwide, feel the beat, feel the vibe. Amazing host leading the ride. Power to the people, we shine. Giving fans what they need. Caribbean spirit, let's succeed. Every show with a good deed. Together we plant the seed. Ride along, join the dance, let's sing the song. From island to island strong, with the host, we belong. Energy high, heart so bright. Tune in, feel the light. Global love taking flight. Every ride a sheer delight. Making waves across the seas. Love and joy in the breeze. Ride along live if you please. Bringing hope with such ease. Ride along, join the dance, let's sing the song. From island to island strong, with the host, we belong. Energy high, heart so bright. Tune in, feel the light. Global love taking flight. Every ride a sheer delight. Making waves across the seas. Love and joy in the breeze. Ride along live if you please. Bringing hope with such ease. Ride along, join the dance, let's sing the song. From island to